Hi guys, welcome to Ask the Doc, where I answer simple questions and give you answers straight and quick to the point without the BS that you can get online. So the question that I have today is actually from one of my nurses, in which we have a patient that is suffering from essentially broken heart syndrome. So the fancy word is called Takotsubo cardiomyopathy, spelled Takotsubo cardiomyopathy, and basically this is a condition that is not specific to Japanese people, but it was diagnosed in the mid-90s, 1990s, and they found out that stress in their population was causing a lot of people to have heart conditions. And a condition called congestive heart failure, where the heart dilates and it loses the structural integrity of the heart, and that when it pumps, it can't pump adequately. That you get backflow, leakiness, and then fluid develops in the abdomen, fluid pools in the lower legs, and then in the lungs, and then they have that congestion component. So yes, stress can cause you to have heart failure. Stress can cause you to have what we call myocardial infarcts or heart attacks. But the big distinction between broken heart syndrome, aka Takotsubo cardiomyopathy, is when you do an angiogram, there's no plaques or cholesterol deposits in the blood vessels to the heart. And an angiogram is basically a study where they thread a line through your veins, and they track it all the way up into your heart, and they access the blood supply of the heart, and they look at if there's any blockage. And usually if there is blockage, they put a stent in. If there's heavy amount of blockage, then they talk about a cardiac bypass, where they take your either saphenous vein, the veins from your lower legs, and they use that as a way to bypass the blockage. So when you look at these type of patients that have Takotsubo cardiomyopathy, the angiogram is flawless, it's clean, and the docs have to either explain why there is a mishap in the cardiac function without a potential cause. So they kind of did some further studies, and they later have a presumed diagnosis that excess stress causes catecholamine increase, and catecholamines are like epinephrine, norepinephrine, dopamine. These kind of chemicals at high doses act as a negative impact to the heart. And there's a presumed mechanism on how that's done, but for this blog, I don't want to go into that huge detail. But at a high dose of these catecholamines, it actually impairs the squeezing factor and the pumping factor of your heart. At low doses, it can actually stimulate your heart, and in the ICU, we use these type of catecholamine components to stimulate the heart, drive up the blood pressure, and we call these pressors. So you can suffer from a broken heart if you are also prone to depression, grief, anxiety. That also puts you at risk for this potential cardiac condition. So I don't know if you've heard it, but back in the days, even you hear it today, is say like an old couple. They've been married for 40 years, and one of the partners passes away suddenly, and that other partner is completely lost. That was their partner for life. They were very dependent, codependent on them, and now they have nobody. And what you see in the elderly is the other partner, within like say a year or so, eventually starts going through this depression, anxiety, grief, and later that puts a big impact to the heart, and they die very quickly from heart disease. It's because of this condition, Takotsubo cardiomyopathy or broken heart syndrome. So let's kind of dive into it a little bit. I took some notes and just to kind of give you guys a little bit more facts about the disease process. So there is what's called a Takotsubo registry. It's basically a database of people that have this condition, and what they noticed is almost 90% were women that suffered this condition, and the average age was roughly around 66.4 years old. And there was another study a little bit smaller in Nature, and it also accounted for almost 80% of the women that had this condition, and they found that a mean age was around 61 to 76 years old. So right now we're dealing with women and postmenopausal women that are at high risk for broken heart syndrome. And another concept of where the catecholamine excess can cause issues with the heart is it causes spasming. So imagine the blood supply. The blood's flowing through a channel, and then you have spasming that constricts and it squeezes down. So as you can see that once the blood vessel squeezes, you can have impaired oxygen flow to the heart. And the more spasming and more oxygen delay you have to the heart, it can cause the heart to have essentially a heart attack. And then the spasm releases so that when you do the angiogram, there's nothing to be found. There's no obvious blockage. So that's another presumed mechanism, is that there's a spasming effect. So let's see here. Oh yeah, so the underlying conditions that make you more prone to having broken heart syndrome is, do you already suffer from some underlying psychiatric condition? If this is acute or chronic, and we're talking about underlying anxiety or depression, major depression, or OCD, and then other conditions are neurological issues, such as, do you have seizure disorder, do you have headaches? And studies have shown that these potential medical conditions can make you more prone to this heart condition. So like I said, that catecholamines at a small amount can actually stimulate the heart, but at a high dose, they've seen in mouse autopsies of their heart that the high amount of catecholamine actually led to a negative effect of the heart and caused it to contract lesser. So that's pretty interesting. It's kind of like a negative feedback loop on why the heart actually was impacted. They still don't know exactly this mechanism of why it did this, but it is seen in mouse heart biopsies. Just a little fun fact, what does Takotsubo even mean? Basically it means an octopus trap, like the animal. And the reason why they named it that is because of the ballooning effect that the ventricle has, and it kind of mimicked the kind of octopus trap that they use in Japan. So give it a look over, look at some couple images. The big thing in the takeaway is, if you are postmenopausal, you're a woman currently undergoing through a grief reaction, say you just lost your husband, or there's a huge stress going on, like financial stresses, you can't make things meet, you're basically battling the concept of homelessness now, a huge derangement in your mental health, And if you are even prone to having underlying psychiatric conditions like depression, major depression, OCD, schizophrenia, or any neurological issues such as seizures, chronic headache, migraines, you are at prone to having a potential cardiac process where that excess catecholamine response can impact your heart in a negative way. So for the women out there, if you are having shortness of breath or pooling of fluid in your legs, or very early fatigue with minimal activity, shortness of breath with minimal exertion, we're talking about breathing difficulty, just walking from bathroom to kitchen or a few flights of stairs out of the unusual, you probably are having some cardiac issue. It should be checked, and you can get a baseline EKG to tell you if there's an oxygenation issue going on. But at the end of the day, a formal blood test called a troponin marker should be done, which tells you, again, oxygen issues. A BNP, which is a brain natriuretic peptide, also gives you clues if the heart is in an overloaded state. And if your numbers look significantly high, it can support doing an angiogram to see if this is truly Takotsubo cardiomyopathy. Odds are it's probably going to be a heart-related plaque dietary issue. This condition usually only affects 1 to 2% of the people. It's very rare, but it can happen. And you just have to have a bunch of factors perfectly set up for this condition to occur. Most of the time, especially American diets, it's because we're eating like crap. We're eating a lot of fatty food, a lot of oils, and we have a lot of plaque disease. We're not exercising, we're not stressing or working our heart out, and it's just essentially fatiguing out because it's been subject to a lot of poor nutrition, poor diet. So at the end of the day, if you are having these kind of concerns, shortness of breath, fatigue, just get it checked out. At least rest easy that it's not your heart. And the doctors can rule this out very quickly in an ER evaluation. And if you guys finding this video very helpful, click subscribe, write a comment. I can make another quick video about something that you had on your mind, and join the subscribe and ask a doc the questions that are I guess plaguing your mind or occupying your mind, and you just needed some medical advice about it. Once again, take care and have a great day. Bye.